Please note, the Council for Responsible Nutrition, CRN, does not endorse any guest appearing on this podcast or any products or services they may discuss. The views and opinions expressed by guests are their own and do not necessarily reflect the views or positions of CRN. Thank you and enjoy the episode.
You are listening to Supplement Source, the official podcast of the Council for Responsible Nutrition. And now your host, Jeff Ventura.
Hello, and thank you for listening to Supplement Source. My name is J.D. Ventura, and I am the Vice President of Communications here at the Council for Responsible Nutrition. I am so excited today for this particular episode because it's something near and dear to my heart. We're talking today about the Access Initiative, and more specifically, we're talking to folks from Direct Relief and VitaQuest and NAFC about a recent collaboration that I am very excited to tell our listeners about and for them to share with you folks in our listening audience. So without further ado, I want to introduce our panel today. We've got Katie Lewis from Direct Relief. She's the Regional Director of U.S. We've got Greg Drew, who we've had on before, Gregory Drew. He's the VP of Innovation at VitaQuest. And we also are joined today by Ariana Gordillo, the Senior Director of Strategic Initiatives at NAFC. Very exciting to have all of you come on to our little show today. Thank you so much for being here.
Thank you for having us.
So we've got some, I've got some questions that I want to ask you guys, specifically about what's been happening in terms of the most recent elements of this initiative that really have come together quite nicely. Why don't we start out by someone run me kind of through the basics. The program's initial supply was fully allocated within just 1 week. What did that level of demand signal to each of you about the need for nutrition access in underserved communities? Maybe we can start out just to kind of lay the groundwork with Greg, because I think that you really could kind of give us just the backstory of what we're talking about, and then we'll just kind of get into how this early success really came together.
Happy to. Hi, everybody. For VitaQuest, what really started as an employee wellness program turned into an initiative to open access to multivitamins across the country. And we manufacture multivitamins. That's what we do day in and day out. And, what better way for us to have an impact in opening access to those that don't have easy access to dietary supplements or multivitamins. So that's how it all started. And, Jeff, what's really awesome about today is having the four partners that really make the execution work, from flavoring and pressing a tablet here in our factories to delivering it to the patients and clientele of the clinics across the country.
Let's get back to that question for a second, because it really, and I'll open this up to the group. Oftentimes we talk about need, and you don't necessarily know unless you do something like this where you make something available, and then all of a sudden these supplements are gobbled up. I mean, the clinics are taking them, are ordering them. So that says, I think, that there is a recognition that there is some benefit to fortifying nutrition in this way for this particular population. There seems to be an early sign that we are indeed filling a need with this. What do you guys say to that?
Yeah, so I think that it's important to understand that nutrition, first of all, is incredibly foundational to healthcare, right? And so when you're looking at patients of free and charitable clinics, these are people who do not have the ability to prioritize preventative wellness products like supplements, like vitamins, when they're struggling to even afford housing, transportation, food, medicine. And so what we have seen with this is that in this case, multivitamins, supplements are really outside of traditional healthcare as many systems see them. And so for these patients to be able to get this tells you very clearly that there is a gap, and it helps them kind of make that connection between preventative wellness, healthcare, and kind of ties it all in together, makes it an easier thing to be able to manage. So I really believe that, programs like these are filling in that gap that traditional healthcare systems often overlook.
Let's hear from Direct Relief for a second. So is this a surprise to you folks that there is this sort of demand already for the program?
Thanks, Jeff. Yeah, it's not a surprise at all. I think it really identifies and actually confirms these gaps that Ariana was talking about. Direct Relief is a logistics organization or support organization. So we work with free and charitable clinics every day, and having, Ariana and the National Association of Free and Charitable Clinics come to us with this, this idea, this program through VitaQuest and Gregory, really just connected the dots and is the foundation of Direct Relief's work. We connect resources to free and charitable clinics across the country. And so I think, we see this every day where Direct Relief is supporting these organizations with pharmaceutical items, with over-the-counter items, and then seeing this really high need for nutrition support. I think it really reflects current and real unmet patient needs.
I think one of the things that's fascinating about your model that a lot of people may not be aware of, and maybe I'm incorrect, but this is my understanding. It's not like suddenly Greg pushes a button and all of these shipments arrive at X number of clinics with unsolicited. I mean, this is a case where you make these products available through your channel, right? And so these clinics are actually asking for these. Is that correct?
Yeah, from the Direct Relief side, absolutely. So what our organization does, what Direct Relief does as a support organization, is work directly with organizations like VitaQuest to increase access to not only medicine and supplies, but to nutritionals, to vitamins, to supplements, really for clinics and health centers to treat the primary care needs of people all across this country. The NAFC has this vast network. We partnered with them on many initiatives, this being one of them, to just ensure that access happens on a continual basis. It's really wanting to have that consistency in supply that is going to help close some of these gaps, especially around nutrition and nutrition access. If patients are coming in today into clinics with unmet needs, these multivitamins aren't covered by insurance. They're not something that people can purchase every day. So really in the scope of this whole healthcare spectrum, this is really helping to close those gaps.
Ariana, I think about food deserts specifically when I have this conversation. You were talking about these populations having trouble prioritizing and accessing nutrition, and some of that is this whole food desert idea that we hear about so often, correct?
Yeah, absolutely. I mean, free and charitable clinics, just us, we represent about almost 2 million patients every year who have no access to health care, mostly all uninsured. That is just a small number out of the tens of millions of people in the United States that do not have coverage of any sort. And so these are people that may be located, and many of them are located in places where the closest nutrition supermarket, let's say, might be a fast food restaurant within 20 miles. And what if they don't have transportation? What if they have one car for a household with multiple people that have multiple jobs? And so they have to figure out logistically how to move themselves around. How do you eat healthfully at a fast food restaurant, let's say, just as an example. So yes, many of them have there's an incredible number of food deserts out there where there just isn't healthy food necessarily in the traditional way that we see it. And so outside of our clinics being able to, and many of them have programs like they will take our patients to something like a dollar store or anything like that and show them how could they possibly purchase as healthily as possible. But outside of even having that or providing them with food themselves, there is this missing component of that supplement that could really help as an entry point to healthcare. And so, our patients are eating what they can, what they have access to. And as you know, with food prices, with everything price-wise on the rise right now, a family has to make the impossible choice of deciding whether to put the healthy food on the table, what they can afford, being able to pay the rent if that's the case. And so our patients are dealing with these kinds of choices literally every day. So yeah, that's why this is so important, especially many of them that are in rural areas.
It frustrates us here at the council because we see all the time these news articles written by very high top tier publications that are very dismissive of supplements, and their shorthand is they always interview as a cadre of physicians that they always go to that will always say when asked, well, it's better to get your nutrients from food rich in, salmon is rich in this and rich in that. It's like, well, yeah, okay. But to your point, I mean, food prices in particular right now are so astronomical. I mean, good luck buying a big piece of salmon and not leaving a good portion of your paycheck on the at the cash register. I can see, really the value here. Let's switch gears a little bit and just talk about success and scale. Greg, tell me about that. What does success look like for you? Like in terms of the program, when is it successful?
We're successful today. I mean, the amount of impact we've already made, and I had a chance to visit Direct Relief, and I had a chance to visit an NAFC clinic in St. Louis, and obviously here at VitaQuest, we're an amazing organization in the dietary supplement business, but we're a group of factories. When I talk about top-notch partners to execute this initiative, that's where one of the reasons I say we've already been successful is because we put a team together that can get a pill into the hands of someone who can't otherwise get it. And I was really, walking through Direct Relief's facility and, seeing everything they do, from filling a airplane full of pallets that might get dropped to another region in the world, to pick and packing individual cases of multivitamins to send to individual clinics around the country, through SAP with exactness and the ability to really have data behind it. Oh, really impressive. And then, visiting the clinic in St. Louis, it was a real experience, and spending an hour and a half there just seeing the work that was done and volunteering with you, Jeff, and a few other members to really understand what the clinics are doing. And, my biggest takeaway, amongst the takeaways, was the clinic director in St. Louis saying something to the effect of, people generally come here when they need to. Right? When they need a medical service or when they need some sort of care. Certainly not preventative, and certainly not in any regular way. Even if they're coming to help on one of these, dollar store trips for access to other things, it's as needed.
Yeah.
Whereas the multivitamin is, it's a 30 or it's a 60-day turnaround, right? Mm-hmm. And maybe more depending on how many kids you have. Right? Because we have an adult multivitamin and we have a kid's chewable multivitamin. Chewable that tastes great to impose compliance. Mm-hmm. What the director there told us is the vitamin is actually what we think will have the patients come back.
Right.
And they'll come back not because they needed necessarily a medical service or procedure, but that's what turns it into preventative visits, because if they know they're going to come 3 or 4 or 5 times a year instead of only as needed, so they see it as an anchor type of tool for them to meet their efforts. So,
well, and I think, Ariana, you probably can speak to this, but sometimes, you need to change the conversation from a reactive, emergency environment, where you're constantly just treating illness, to, a narrative where you're maintaining health, right?
Yeah, absolutely. And just to round out what Gregory mentioned, impact success is measured both quantitatively and qualitatively. In terms of quantitatively, we're seeing the fact that Direct Relief literally ran out of the first huge shipment almost immediately. That says so much. Looking at the geography of all the clinics that were able to be helped, the fact that they were, I believe, in over 25 different states already, That's huge. We can see that, but it's also about that qualitative portion of what Gregory was mentioning. It's understanding and the meaningfulness of how quickly clinics engaged, but also paying close attention to those stories, to that feedback that's coming directly from the organizations that are the most trusted partners in the community. That is success. It's numbers combined with that qualitative feedback that tells us and reinforces the importance of programs like these, which are this is incredibly unique. I just want to make sure that we put that out there.
And I think that kind of dovetails nicely into talking about the innovation, the innovativeness of this model, because I remember, I'm not by any means criticizing the former version of the Access Initiative, but I mean, we did an Access Initiative version that predates me. And when I came on board 3 years ago, it was very, we kind of gave member companies 3 different choices to pair up their donations to these different organizations. And then there was kind of left to them whether or not they wanted to do anything on the ground in terms of volunteerism with their employees and that sort of thing. And people stepped up. I mean, it was a great initiative. But what's so incredible about this is it really is a system. There is a distribution sort of system in place that I think, we've mentioned it's fairly unique. I mean, I'd love to hear from you, Katie, about, is this a unique kind of model, or do you see this kind of model with other goods and services being donated through your channels?
Yeah, I mean, this is a unique model. I mean, this at VitaQuest, they're manufacturing specifically for charitable use. That's highly unique. That's the intent of the donation. That's the intent of the team behind these decisions. And that is, that's what we want to see more of. I think, when we're talking about success, we're really, this donation, this first round really demonstrated that we're filling, an unmet need. There is a need there, and we're helping to fill these gaps. And so I think really it's taking a business approach to a charitable purpose. And we have the network through NAFC. We have the distribution channels. So turning that up, I mean, we can scale that up as big as we need to. I mean, I think really the goal here then is around that predictability and scalability.
Well, let's talk about, it's an exciting idea, and let's talk about the scalability of this and really the call to action to those, in our audience, which are mostly, I mean, most of our audience members are in the supplement industry, stakeholders in the industry. What's a call to action? I mean, obviously get involved, but Greg, what do you think the call to action is in terms of scalability and sort of taking this to the next level?
We're taking it to the next level, and we're not alone. We do have our first corporate partner, a CRN member that is pledged to also support, and maybe we'll make that announcement in our next podcast, Jeff.
Yep.
But that's really what it's about. It's about, stakeholders of the industry stepping up and us, walking the talk, right? There is an unmet need for dietary supplements. Who wants to join in and help get access through direct relief, through NAFC clinics? And really the actual transactions are easy through the CRN Foundation, who's really stepped up to make sure that everything is aligned with nonprofit standards, and the folks that do participate, and there are many ways to participate, can leverage that donation however they wish.
Yeah.
So, we invite members of the dietary supplement industry and beyond, suppliers, manufacturers, brands, even retailers across the spectrum to participate. And the 4 partners are here to be able to execute on that. But the scale is really through growing our partnerships. It's very easy to participate with either donations of funds or other creative ways as well.
Ariana, you had something to add?
Yeah, I wanted to add to what Gregory is saying. This partnership, it is easy to get involved in the sense that this partnership is a perfect example of cross-sector collaboration. And the whole point of its success, and what we've seen so early on, is that each one of the organizations, it's playing to its strength. Each one of the organizations brings that unique strength to the table, whether it's CRN helping to spark that connection, CRN helping to bring visibility to this issue, to this opportunity, VitaQuest being able to make that, frankly, incredible decision to create products specifically for charitable distribution. And then, which again, we've talked is highly unusual and impactful and unique. But then Direct Relief being able to bring that logistical expertise, making it happen. And then, the NAFC being able to connect the program directly to the trusted free and charitable clinics already embedded in our communities nationwide. So I think that cross-sector collaboration we have already seen so quickly is easy if everyone just plays to their strengths. So we're not asking anyone to, recreate the wheel in any way or create something different. I'm sorry. So as Gregory mentioned, it's something that I think is relatively easy by being yourself in terms of whether you are a manufacturer, any kind of organization you are. You can plug into a collaborative like this, sparked by the CRN Foundation, and really make a real impact, not just numbers, but like stories and real change.
Connecting those dots, I think that's the beauty of this. And this is a perfect example of an ideal type of program that we all want to participate in. I think at the end of the day, what we're getting through this is, again, predictable planning for the clinics. Predictable access that's gonna result in more reliable patient care, better adherence over time. So to have these, large names and entities and organizations come together for that intended purpose is really a special and wonderful thing. I think that we're all here for and all want to be a part of, and welcome others to join us.
It's an open call for partners. It really is a partnership. I mean, it's a co-branding experience. These are, this is a brand of multivitamins. It's a charitable brand that's available at these clinics, and partners, have the opportunity to be part of that brand. So it can be
and
used.
There's no minimum, right? And not to interrupt you, Greg, but there's no minimum. I think that's important to say. Is that the member that you talked about having already signed on? I mean, it's not $8 bajillion. So that's important, right? Because of these. Because this is a collaboration. Gosh, this, Ariana. In the world of in these clinics, it's really a constellation of support, whether big or small, from a multitude of different stakeholders. And I think that's an important point, don't you?
Yeah, the minimums are really just around ease and logistics. So, we'll run a batch of vitamins and we'll fill an even pallet or 2 or 10, depending on the demand and the support at the time. So it's generally around, what makes sense to get it from point A to point B. But it's not our first partnership that should be announced relatively soon. We're really, really excited about, and I think will be the model for the way other folks can join really easily.
Yep. Well, I want to just thank all of you for taking the time out today, but also for just stepping up. It's an incredible thing. Every single time somebody takes, some of these supplements and is improving their health or their family's health, there's no words for that. It really is an incredible thing. And it's made possible in no small way by Katie Lewis, Gregory Drew, and Ariana Gordillo. We thank you, and we thank you for being part of this podcast today.
Thanks,
Jeff.